Hello, friends. Welcome to 100% Honest Interviews. Honest because here we are not here for any promotion of any institute or platform, but we are looking at to maximize the benefit of students so that they can follow their role models. And we have one such role model with us today, Dr. Omkar Sonawane. Welcome, Dr. Omkar.
Thank you so much, sir. It's a pleasure.
Friends, I must tell you why I organized this interview at a very short notice to Dr. Omkar because I received a message from him today that he's going to join general surgery branch subject as his professional career very soon. So first of all, Dr. Omkar, heartiest congratulations to you and your family.
Thank you so much, sir. It means a lot.
Welcome. Dr. Omkar, in this particular 100% honest interview, I will talk less and you will talk more, and thousands of FMG and PG aspirant students will be listening to you. So, first of all, I'd like you to introduce yourself, you, your family, college you have graduated from, and any other thing you want to share with us. Please proceed.
Okay, sir. Sure. Thank you so much. So myself, Dr. Omkar Sonawane. So I belong to Maharashtra and I have been graduated, like completed my MBBS from International Higher School of Medicine, Bishkek, Kyrgyzstan. And after in January 2020 is what I graduated. And after that, I cleared my FMGE exam in my very first attempt in August 2020 session with a score of 221. After that, this was my very first PG attempt in NEET PG 2022, and I was able to score 540 marks with a rank of 5,953. And I have been recently allotted MS General Surgery in Government Medical College, Aurangabad in Maharashtra itself.
Wow, this has been really wonderful. From FMG exam to clearing NEET PG and getting a branch of your choice, which is so close to your heart. Dr. Omkar, let's break this interview
Yes,
into
sir.
two parts. First, we will look at your journey through FMG examination. Friends, I must tell you, 221 is a super score. So, Dr. Omkar, please share with us what strategy you have followed, how you were able to crack this exam with such a high score in just your first attempt. Kindly tell each and every student who is going to watch this video the kind of efforts you have put in, the challenges you faced, or any other thing you want to share.
Okay, sir. So actually, I graduated in January 2020, and I came back in Feb 2020. So that was a very tough time for me to handle because I came back in February 2020, and I was just devastated to know that I lost my elder sister and my younger sister's 3-year-old daughter to an accident, almost 1.5 month earlier, thought to not to inform me, and then when I came back I got to know about it. So
Oh,
first of all, I was devastated with that. I could not handle it, but like my family and my relatives and my friends were there to support me through it. So with that, the only thing I had in mind after that, right, I was definitely motivated. I wanted to clear FMG in my very first attempt, but then it became my motto to clear it in the first go itself because it was my sister's dream, and she has been my mentor throughout my life. So after that, even my family was suffering from this. I'm not expecting any sympathy on that, but just sharing because I have gone through it. So after like even 20 days after that, I came back to Delhi, and I just started coaching. Most of the subjects I did from the app itself. In the final year, I like in the final year I only did over here. And like I joined the coaching institute because of only one reason, because I could have done from the app itself, but some subjects were like huge, and I was not able to complete it over there. So that was the only reason. So a lot of people told me that don't follow multiple sources. So I thoroughly followed that. I did not follow multiple source. Rather, I chose which subjects are to be done from the app and which subjects are to be done from the coaching institute. So that I had a clear demarcation, and that was the reason I just did not got confused with multiple sources and a lot of information that loaded me only. So that was the first strategy that I got to know and that I followed thoroughly. So after that, once I joined the coaching and I was doing it simultaneously from the app, also I was covering all the subjects. I completed my revision, I completed my subjects till March or April mostly, and then I started my revisions usually. Like, I hope all of us are quite aware that in March 2020, the lockdown started for COVID-19, and there was nothing which was certain at that point of time. Everything was unpredictable. So, like, the exam was postponed and postponed. So, usually in June, I went back to home from Delhi, and I started my revisions over there. Why in June only? Because I made it sure once I'll read all the subjects, and once I'll go through one revision, and then only I'll go home, because everybody was going because it was a lockdown. But I made it sure that nothing was going on over here in Gautam Nagar. But then I also made it sure that I'll only go after I complete my first revision. And therefore, once I went home, I was like handling the shop as well, and like all of the other stuff in the house. And I kept my revisions going on. 2 or 3 revisions were completed till the end of August, when 31st August was the day when the exams were conducted. And on that day, I was also nervous like everybody. But what I felt was what has to be done has been already done. Nothing I could do about that right now at this point of time, worrying about it. So I just thought, whatever comes my way, I'm going to take it. Whatever question comes my way, it has been already served in my platter, and therefore I need to just take out the best out of it. Whatever I know with my limited knowledge, I try to give my best. And so after first paper, everybody was like furious, like, what is the paper? What is the exam? This is the first time, and all of that. I was relaxed because I know I had done like well. I'm not sure I would pass, but I had done quite well. So in paper two also the same happened. And then like I was doubting myself at some point of time, but my father was quite sure that you will do it in the first go itself. So that was the journey through which I went for FMG.
Wow. Dr. Omkar, first of all, I was really, frankly, very sad. I was not aware about this development you told me happened with you. But I must appreciate you at the same time that you didn't lose focus. And in these times of crisis, I've seen that friends and family always come for help. So their love is unconditional, no doubt at all. But I like the way you systematically kept on pursuing for your dream. And I noticed one word that you used categorically, revisions. So, Dr.
Yes, sir.
Omkar, a lot of FMG aspirants, besides NEET PG aspirants, will also be watching this interview in coming weeks, days, months, or years. So, if you have to advise a FMG aspirant to crack the upcoming exam, or someone who is preparing for next or the FMG or the NEXT exam 6 months down the line, keeping FMG students' mindset and his preparation while his graduation is being he's been doing his graduation. So, what all things will you like to advise to a FMG aspirant? His strategy, what it should be.
Okay, sir. So nowadays, I have seen like FMGs have been really working hard, and they have started studying from there itself with the app or with the classes which are conducted. So nowadays, there's a huge difference that was seen from my time. But still, there are a lot of people who feel that nothing could be done till the end, till the time they graduate. They feel it's very difficult. Nobody could clear it in the first attempt. So that mindset they need to get rid of it first of all. Everything could be done. The only thing is you need your hard work and perseverance. That is definitely that going to take you through. So that important aspect they need to believe in. And once they start their like your preparations for your FMG exam, the first thing they need to plan it out, because a lot of people I meet every day, and I meet a lot of juniors as well as the FMGs. So everybody they do not have a plan actually. So they go without a plan, and therefore they are off track. Most of the times they get off track from the revision sessions or from the preparations itself. So the first important thing is to plan it out. At least a rough plan they should have, like till what time they will complete their first reading or watching their videos or attending the classes. And then when they will start their revisions, and minimum 2 revisions are to be completed. Minimum, I would say, like that is the must, because without revisions, I always say to people like we are not from the Einstein's lineage, therefore we will not remember it in the first go. We are not near genius people. We need to revise it multiple number of times, and that is how we'll like make it through. So that's the most important thing. Apart from that, single source, because every day there's something coming new into the market, so people like get behind that. So like this will help me pass the exam, or that will help me. So I would always advise that please follow your notes thoroughly, trust your faculties. Whatever they have given, that's more than enough to pass the examination. Just believe that and read that and give multiple revisions to it. Solve MCQs alongside. a lot of people, they either read it or they either only solve the MCQs. So there should be a balanced approach between both of them. If you're giving time for your revisions, please make sure 1 or 2 hours daily you are also solving MCQs, 30 to 50 initially to 80 to 100, like towards the examination, as Govind sir told us during the exam time. So that was my basic approach which I followed. So yes, sir, that is how I prepared for my FMG exam. And apart from that, sir, like every morning, half an hour, and every night, half an hour, I used to give to images and to one-liners. Like images, I could not get a lot of stuff at that point of time. After August, it became a trend that image-based questions are really important. But at our time, so whatever images I could get, or whatever one-liners I could get, because a lot of people say that they failed because of paper one, or the paper one was quite difficult, because I feel in paper one there are straight one liners sometimes, and in one liners we cannot help it. In at least clinical cases or clinical vignettes, we can get some hints. In one liners, either you know it or you don't. So at least spending half an hour a day, I feel it's more than enough for one liners. So that was my approach, sir.
Wow, Dr. Omkar, if I could summarize what I've gathered, one number one thing I must compliment you. Your approach was very, very systematic and very well planned. So all the FMG aspirants, I think, must be understanding now a lot of systematic planning is required. Do use only one source. Do not keep on changing the source. Don't fall into the fear of FOMO, right? So keep on using one source, trust it,
That's
and
true,
give your
sir.
100%. And Dr. Omkar also focused on MCQs, daily practice. Revisions are must. He's saying minimum 2 revisions should be done. Then he has also mentioned one wonderful thing. He's saying that he used to devote time to images and one-liners. I think that is a wonderful approach, because images, definitely when you go through them, not just consolidates your concept, but you also have a comprehensive revision of a course in a single go. So that was really some comprehensive and wonderful strategy, Dr. Omkar. And before I move to the next question, I must tell you one thing. I've been teaching FMG aspirants as well as NEET PG INICT aspirants since last 17 years now. And earlier there used to be a lot of gap between the Indian medical graduate and foreign medical graduate. But over last 5 to 8 years, I've seen this gap has narrowed down, and both FMGs and Indian medical graduates have almost come to the same level. In fact, if I look at the FMG paper of last 2 years, two of the papers were more difficult than the NEET PG exam itself. And now they have a common examination body also,
Yes, sir.
National Board of Examinations. So definitely they may be having a single question bank or a similar question bank. So definitely level of question is absolutely same. So whether it is a FMG aspirant or NEET PG, both have to give more than 100% of their input, right? Okay, now
Yes,
was
sir.
preparing for NEET PG an automatic choice, or did you take a decision based on some other factors?
So first of all, like why I chose MBBS was just a dream of my like what my parents saw. Like definitely, I would say like I wasn't sure about it very much, but my father, he completed 3 years of BMS and left in between due to some financial reasons he had. So he always had that someone from the family could do MBBS. My like smaller sister, younger sister could also, like smaller sister, she could also not do because of some financial reasons. At that time, that there was a huge financial crisis our family was facing. So at my time, like my sister, she said that she'll delay her marriage, but she wants me to get admitted in the MBBS. Not in India, if it's possible. I was trying to get into Bharati Vidyapeeth, but that was huge amount of money I had to pay over there. So, and my father didn't wanted me to repeat. So that was the reason I chose and I went like abroad. So that was the reason I had always in mind that I had to complete MBBS. But while completing MBBS, one more fact that arose in my mind was like there was always something fascinating about surgery. I used to think like जो बोलते हैं ना, like until and unless your gloves are filled with blood, you are not actually a doctor. So that always fascinated me, and that was the reason I had to go for surgery. And after usually cracking my FMG exam, like I started at least teaching somewhat, like taking revision sessions for some FMGs, and then definitely I saw it that a lot of potential is there, but the only thing is we don't make the most out of it. And as I was revising every subject with them, so it made me like it made sure that I had to go for NEET PG itself. So it was definitely a planned decision, and that was the reason. Like when I was when I was doing my internship. I did not join any of the locums or any of the other jobs, because that was the reason I came to Delhi for internship. As my family was having some financial issues, so I had to take care of my own expenses, because that's a common thing. A lot of medicos experience that now we need to handle our own expenses at least. So that was the only fact. But I'm grateful that did not have to do that, because in the third month itself, I started earning some amount of money to manage my own personal expenses with these revision classes. And these revision classes helped me to be in touch with the studies as well, because internship was hectic. But at least I used to study for the sake of these students who were trusting in me, who were believing in me. And that how it went. And so the first attempt, I did not actually study properly for the NEET PG anytime. So it was always the revisions that kept on going. And yes, sir. So that is how it happened.
Wow, this is really wonderful and something new for me also to learn. Now I'll look at one or two things here. Earlier you mentioned about Einstein, that we doctors are not Einstein. Believe me, all doctors are average students only, including me also, including you. So somehow we have to come out of our skills to perform in these type of examinations where marks and ranks decide everything. Frankly, I'm not worried too much about ranks and marks. If student says I've attempted my exam with 100% effort, that is enough for me. But still, this is how it is measured in terms in our society, so that is fine. But how you overcame challenges in your personal life at family front, how your family supported, this is really inspirational for anyone and everyone, right? So friends, trust your family, take them into confidence, and any problem, come back to your family, friends, and teachers. They will never disappoint. Now, another thing, Dr. Omkar, how exactly did you prepare for NEET, PG, or INICT exam? Because during PG preparation, there may be a different set of challenges as compared to FMG exam. I think you are the best person right now in the country to address both set of students. So how they were different from FMG exam? What extra did you do? Students talk about revisions, grand test, mock test, appearing in live classes, only sticking to online platforms. So how did you face these challenges, or anything else you want to share, so that NEET, PG, INICT aspirants can follow your advice and they can also get the subject of their choice?
Yes, sir. So actually, as I've told, sir, there was no proper plan. Like for FMG, there was definitely a proper plan that I followed, a schedule that I followed. But for NEET PG, I did not prepare a plan. That was my mistake. I accept that. But what kept me going, as I told you, sir, it was the revisions and multiple revisions of each and every subject. Because before every FMG, like I have been taking it for almost 2 years now. So before every FMG, I used to take some test and discussions or some revision sessions, like for the students. And so I used to revise all the subjects, like all your notes. I used to go to I used to go through it almost twice in 6 months. So for some subjects, it happened multiple number of times. Some subjects definitely which I did not read properly was micro FMT. So this I could not read properly and revise properly. But I used to cover it and integrate it in the other subjects. So that was my approach. I feel, and that's required also. That's the need of the hour. First thing is important, like people try to memorize everything. I don't think so it's required even, because once you understand the concept, that's fine. I feel like you don't need to memorize things, because if you try to memorize subjects like OBG, surgery, or even PSM, then you will try to forget most of the subjects like which are actually volatile and memory based subjects, something like pharma, micro, anatomy. So those are to be kept for, I think so, for the memorization. Whereas all of these, you try to understand concept behind it at least as much as possible, or whatever you can make out of it. And even I feel like, sir, I've learned this from you. Even PSM is a subject which is not completely memory based. If you actually try to understand it, there is some logic behind each and everything, like why they would have planned it or why there is a reason for it. So PSM was one of my favorite subjects, like during my FNG also. Like out of 33, I was able to score 31 in PSM in August. So that was because of you itself. So like I feel there's a reason to everything. So you need to try to understand that concept, so it will be retained in your memory for a longer duration of time, and it will not be short lasting. First thing. Second, as I've told you, sir, integration is important. So what I make sure is I to tell this to students also, like whoever are the aspirants, try to read a subject. For example, if I'm reading measles from PSM, I don't only limit myself to learn the vaccination, like the doses and the strain. but I also try to like remember everything which is related to it, even from pediatrics, even from microbiology,
Okay.
everything. So I try to recall whatever I know about that particular topic. So integration has helped me definitely. Even in medicine, I try to recall pharma and patho. So that is how I go through a subject multiple number of times. Even if I'm not picking up that particular subject for revision. So apart from that, sir, one big mistake that I did, and I would like not any NEET PG aspirant to do that. That was like not solving any MCQ. The reason being, sir, like I did not have any subscription in the last few months, so I was not able to solve even one MCQ. Yeah, but one important thing that I did was I used to prepare MCQs like for the same sessions that I took. So while preparing MCQs, I like maybe over a period of time, I developed that mindset like what the examiner is going to ask you. Not exactly, but at least I got an idea. So which are the topics he would be asking questions from. So and that I analyzed with all the previous year questions, all your videos itself, like which are the topics or which are the questions the examiner likes to focus on. Like he definitely likes to ask some tetrads where the fourth option would be an exception definitely, so something like that. So I analyze that as well. So I hope like everybody should solve like enough number of MCQs or give enough number of granters as well and analyze those, because I've seen a lot of people telling me that I've like solved 300 MCQs daily. Like I've heard this as well, but I say, how much are you able to actually retain? Because if you're not reading their explanations, those are of no use. So better solve 50 only, but at least read all their explanations and understand the concepts. Yes, sir.
Wow, fantastic. This is something new again. This is coming out of this honest interview that you were not able to solve MCQs, which majority of students, even majority of educators, teachers feel that they are key to planning. Now, I am looking at a contrast here also, Dr. Omkar. Initially, you said there was no planning much from your side regarding NEET PG, but I am happy at the same time you actually did surgical dissection of how to plan, and you have not just planned, actually you have executed it also. So that is wonderful that you focused on consolidation of concepts. MCQ practice you were not able to do. This is really something honest, that you are able to identify your mistakes, and despite that, but because your concepts were
Yes, sir.
so clear and so consolidated, you were able to think also what kind of MCQs an examiner is likely to ask. So this is something really, really wonderful. Wow. Wow, Dr. Omkar. Now this was the academic part. Now before
Thank you,
we
sir.
conclude the interview, anything personal you want to share with any student, be it FMG, NEET PG aspirant, INECT aspirant, undergraduate स्टूडेंट ऑफ इंडिया और अब्रॉड, तो कोई भी चीज जो आप अपने डायरेक्ट दिल से
Mhm.
बोलना चाहें, इंग्लिश और हिंदी, यू आर मोस्ट वेलकम.
Okay, sir. So first advice, definitely being a FMG, first advice would be for them itself. So all the foreign medical graduates out there, please start believing in yourself. You're no way inferior to anybody over here. The only thing is, I always tell them, don't just be jealous of Indian medical graduates. Okay, these people have worked hard to get into those government medical college at that like during that 12th, they have really worked hard. So this is your time to work hard now. Okay, so please remember they have worked hard at some point of life. So this is your time to work hard. And after you pass your FMG, please don't lose hope. Everything is possible if you be persistent. If you are actually passionate about something you need to do. If you are able to pass your FMG exam, why not NEET PG? So I feel almost, as sir have already mentioned, that almost the exams are of same level. The only thing is, please while studying for your FMG, please try to build the concepts and don't try to memorize things. And even after that, even if you have passed FMG, get back to studies, because during internship, all of us are definitely a lot interested to learn the skills, because we have not learned it earlier, definitely at any point of time. But alongside, I feel so like I have been overworked at a lot of times because I have wanted to learn skills. But please make sure that even if you work one or more day, like if you overwork for 1 or 2 days, get back to your studies. At least try to solve MCQs, at least try to revise something, be in touch. That's the most important aspect, because a lot of us lose that touch with the studies itself. And for all the NEET PG aspirants out there, I hope all of you have been preparing really well for your exam now. And whatever mistakes I did or anybody did, please try to like rectify them in your preparation and make sure that you don't follow anybody's schedule, because like I have been also told, like, this is a good schedule, that is a good schedule. Always make a schedule which is based on your strengths and weaknesses. Nobody knows you better, or nobody knows your strengths and weaknesses better than you. So try, like, a lot of people, like, so I'm getting messages that please make a schedule for me. I think, like the person can make the best schedule for himself or herself. So that's the most important thing. Alongside, apart from this, yeah, a lot of people are saying, like, sir, depression aata hai vagera. So I feel, I would have also gone through the same thing. I also had enough reasons or enough excuses at that time. But the only thing is, I always tell कि उन लोगों के लिए करो जिन्होंने जिंदगी तुम्हारे नाम कर दी है. So try to do something for them at least. Like, they have been suffering for the whole life. They have been trying hard to bring happiness to you. So this is your time to give them something back, and that's the only advice, sir.
Wow, Dr. Omkar, I love the sentence that you used in between, that Indian medical graduates, don't be jealous of them because they have worked hard at some point of time. Now it is time for FMGs to work hard. In fact, from your statement, I can say that let's try to create a bridge. See, already doctors community don't have
That's
a
true,
very
sir.
good image in much part of our country, thanks to media and movies. But from our doctor side, if we can stay united, we can actually try to improvise our image over the coming time. And second thing you mentioned about that you have to give back to those, be it family or community, who have been a part of your journey or success. So that's something really, really wonderful.
That's true.
Wow, Dr. Omkar, today's entry was really fabulous. I hope a lot of students actually will, I'm sure they will, are going to benefit from this particular interview. और हो सकता है इस इंटरव्यू के बाद वो आपको या मुझे कांटेक्ट करें, और आप और मैं तो हमेशा अवेलेबल रहेंगे उनकी हेल्प करने के लिए. तो
Yes, sir.
पहले तो मेरी तरफ से और जितने भी एजुकेटर्स हैं, चाहे वो किसी प्लेटफॉर्म के हों, किसी इंस्टीट्यूट के हों, चाहे वो किसी कॉलेज में पढ़ाते हो, उन सबकी तरफ से आपको हार्दिक शुभकामनाएं, बेस्ट विशेस फॉर योर प्रोफेशनल करियर.
Thank
सो
you, sir.
वी विश यू ऑल द बेस्ट. आई एम श्योर यू आर गोइंग टू डू एक्सेप्शनली वेल. So take care, stay
Thank you so
safe,
much,
stay
sir.
healthy, stay close to your family. Best wishes.
Thank you so much, sir. It was a pleasure, like, sharing the screen with you.
So thank you so much. Bye bye.
Thank you so much.